All right, I have 12:02. We will go ahead and get started. Welcome, everyone, and thank you for joining us for our Healthy Living lecture on the ABCs of virtual care, hosted by Henry Ford's Senior Healthy Living Program. My name is Marie Lee, and I will be your moderator for today's lecture. I work in the Henry Ford Health's virtual care department as a manager, specifically working with the technology that our providers and patients use for virtual visits. This afternoon, you will hear from Allie Hunter, a virtual care consultant for Henry Ford Health. Allie will provide an overview of virtual care, including the benefits of having a virtual visit, the health concerns best suited for these visits, and the technology needed to participate in a virtual visit. We'll also conduct a demonstration of a video visit. We hope you had the opportunity to review the handout, which was emailed to everyone earlier this week, and also as a reminder this morning. If you have any questions related to the handout, Allie will answer those after her presentation. Please be sure to type any questions you have in the chat box. If for some reason you did not receive the handout, please send us an email at healthyliving@hfhs.org or call 313-874-5425 and leave your name and email address. This information will also be put in the chat box. And I see it now. Thanks, Michelle. Following Allie's presentation, we'll have a question and answer session. So if you have a question during or after Allie's presentation, please type your question in the chat box and please avoid sharing any personal medical information. Also, to ensure that smoother experience for all, please turn off your cameras and note again that your microphones have been muted. This lecture is being recorded and will be available to listen again on the Healthy Living Lecture Series webpage at henryford.com/healthy living. Now I'm happy to turn it over and introduce you to Allie Hunter.
Thanks, Marie. Welcome, everybody. My name is Alexandra Hunter. I also go by Allie, and I am so excited to be here with you this afternoon to virtually present on the ABCs of virtual care. We have a lot of content to get into today, so let's dive in. So Marie already highlighted a little bit, but what I'm looking to cover today is what is virtual care? Virtual care is an ambiguous term, and I hope that by the end of the presentation, you will be able to understand exactly what virtual care entails. What are the benefits of virtual care? Why should you conduct a virtual visit? What are some of the health concerns that are best suited for these virtual visits? And maybe you want to know about the technology that you need to participate. Marie mentioned we're going to conduct a video visit demo using a laptop or a desktop, and then we'll wrap up our session with some final thoughts and resources, as well as a question and answer. Ultimately, my goal here is for you to walk away with one new piece of information that maybe you weren't privy to prior to attending this webinar. So before we dive in, I want to highlight that roughly 37% of our virtual visits are utilized by individuals in the age group of 51 to 75, and this is our largest group of users. Knowing this piece of knowledge, we at Henry Ford Health make sure that we want to ensure that we are engaging with this demographic to ensure that virtual care is easy to use and accessible. We recognize that there are various learning styles and comfortability with technology. So this presentation is tailored to things that your age group cares about in delivering your healthcare and getting care that matters to you. So what is virtual care? Well, you may have heard this term before and not known exactly what it is, and I'm going to change that. So virtual care, in a technical definition, is healthcare services delivered remotely through digital technology, including telehealth, telemedicine, remote monitoring, video, audio, and instant messaging. It can be broken up into two categories: synchronous, which is live two-way communication, such as video or telephone, and asynchronous, which is not in real time, but store and forward. So another way to look at that might be a MyChart message if you've ever sent one to your provider. Our mission as a virtual care department is to evolve innovative care delivery through accessible technology that drives connection, collaboration, where, when, and how it is needed most. In other words, Henry Ford Health is committed to connecting you, our patient, with the care you need, where and when you need it. So what does this mean to you? These are all kind of technical components, but what does this look like for you as a patient? Well, virtual care comes in the forms of video visits on demand, scheduled video visits, e-visits, telephone visits, clinic-to-clinic video visits, and our MyCare advice line. To access our virtual care options, you need to have a MyChart account. And if you are unfamiliar with MyChart, it is a patient portal tool that allows you to connect conveniently to manage your healthcare. It's available 24 hours and safe and secure to use, 24 hours, 7 days a week, 365. Some of the things that you can use your MyChart account for are scheduling, canceling, and reconfirming your appointment. You can conduct a video visit with your provider. You can view lab and radiology results. You can renew a prescription, and you can even pay your bills. There are two ways to access MyChart and or create an account if you do not have one. The first is from your computer, and you can use this link. And the second is from your phone or your tablet by downloading the MyChart mobile app in the App Store or the Google Play Store. So for the bulk of this presentation, I'm going to be focusing on 3 of the virtual care options that I highlighted earlier. Those are scheduled video visits on demand, and e-visits. All of these are accessed through the MyChart patient portal, and the following screenshots on the next 3 slides are all taken from MyChart, and I'll walk through exactly how you access that. So I have my mouse here on the screen. But upon logging into the patient portal, in the top left-hand corner, you'll select your menu, which will pop up this larger image that we have here on the left-hand side. From here, you'll look at Video Visit on Demand to access that, or Send an e-visit to access an e-visit. For scheduled video visits, we'll move on to accessing it through the Visits tab, which is just to the right of your menu in the patient portal of MyChart. From here, you'll be able to view all of your upcoming and past appointments, both in person and virtual. In this instance, we can see that we have a new video visit scheduled. And so for further details, we will click on the Details icon, which will then bring up this image that we see in the bottom right-hand corner. We have the Join Video Visit icon, the Confirm Our Visit, and our our e-check-in icon as well. You also have the ability to test your camera and microphone. Now we can see that the Join the Video Visit icon is grayed out, but it will turn green 10 minutes prior to your appointment, and that allows you to know that you can connect to your provider at this time. So you might be thinking, okay, I know how to access these options, but what would I use them for, or why would I use them? So let's start with Video Visit on Demand. This service allows you to video chat with a Henry Ford primary care doctor whenever you need care, 24/7, 365. It's available to patients located in Michigan and Florida at the time of your visit. This is a great option if you're sick and you don't feel like leaving your house and you can't get in with your provider that is your standard PCP and you need care. The idea of waiting in an urgent care is just not something that you really want to do, or even driving there. So it's a great option if all of those things are true and you're looking to get some care conveniently. You're put in a line with the average wait time of 10 to 15 minutes, and then you'll be able to see that first available provider who is from the primary care division. The screenshots on this slide represent different parts of the process, ultimately connecting you to the provider, which is the screenshot that we have here in the bottom right-hand corner. For scheduled video visits, it's exactly what it sounds like. This is a video visit appointment that is scheduled with your specific doctor for a routine or follow-up care. Here you're talking to your specific provider. It's similar to an in-person visit where it's designated time slot and that you have a set amount of time that you'll be specifically speaking, to your provider for the reason of the visit. The difference is the access point. So instead of going in person to the clinic to see your provider, you are in the comfort of your own home in a safe, secure, well-lit location, logging into MyChart to connect. And we'll go over in a few slides specifically what are some health concerns that would be best suited for these types of visits. Again, the screenshots on this slide are representative of different parts of the process. And that join video visit icon in the top right-hand corner of this slide will turn green 10 minutes before, and that indicates that you can join that video visit, prompting you to the image that you see in the bottom right-hand corner of this slide. Lastly, we have e-visits. With e-visits, you can submit your symptoms through an online questionnaire to your doctor. You can receive a response from them within 1 business day through your secure MyChart account. And if you want to be seen, if you want a response sooner, you can also select a 2-hour rapid response. And the first available primary care provider, we will answer your e-visit through a prescription or advice, depending on the reason for your e-visit. So when should you consider using an e-visit? Well, these are for issues that maybe you don't want to wait in line and utilize the video visit on demand option, or maybe you don't feel that you verbally need to speak with a provider. You're looking for just getting a prescription, that you have a maybe generic antibiotic need that you are looking to get resolved, or also you might need medical advice. So these are generally common and non-urgent questions that you want to consider for our e-visits. And again, just to mention, we'll go over in a few slides what some of these health concerns might be. So a few things to note with e-visits: these topics that are available have been vetted by providers and are designated to easily resolve your need. And if you go down the path of conducting the questionnaire and filling it out and realize that your need falls outside of what the questionnaire can resolve, it will point you in the direction to either call the clinic or schedule a video visit or do a video visit on demand, and you will not be charged. These are different screenshots on the slides that give you a taste of what that looks like if you are looking to conduct an e-visit, and you can see the variety of different topics that fall into the e-visits on the left-hand side, as well as I've selected in this instance for this right-hand side image anxiety as my reason for completing an e-visit, and you can see the questionnaire format that it begins to ask you about what some of your symptoms might be. Okay, so we've learned about these 3 specific virtual care options, and now you know how to access them and where they are within MyChart. But why should you conduct a virtual visit? What are the benefits to you as a patient? Well, there are lots. Firstly, it's a convenient and secure way to video chat with your provider or conduct an e-visit questionnaire and get the care that you need. We all have been in a place where we feel awful, and the last thing that we want to do is get in a car and drive to the doctor's office, or we have really low and limited energy. Utilizing our virtual care options is a great way to solve that problem, because you can do this from the comfort of your own home without having to leave. Everybody has experienced Michigan winters and knows that the last thing that you want to do is go out in treacherous conditions and drive to your doctor's office. Most of us don't live 5 minutes from our doctor's office. And so, again, utilizing a scheduled video visit or a video visit on demand or even an e-visit is a great option and alternative in that instance. Maybe you work or maybe your caregiver works. Utilizing our virtual care options, you don't have to take off as much time as maybe you would for an in-person visit to drive to the physician's office. Maybe you take on average 2 hours of time just for travel back and forth and then to conduct your actual visit. You can save a lot of that time and your caregiver's time as well by utilizing our virtual care options. Perhaps you rely on somebody for your transportation, or maybe you're uncomfortable driving to your own appointments. Well, with virtual care options, you don't have to rely on someone else to provide that transportation, and therefore it might be easier to adhere to your follow-up appointments because you can conduct them in the safety of your own home. Lastly, or the last two I should say, are that it's easier for individuals who are involved in your care, such as your caregivers or maybe your family members, to attend your visit. There is an invite third party option on our video visit options where your significant other, your child could attend the video visit from wherever they are located and join and listen to the provider, ensure that they are getting down the instructions that are given to you for your care, and also ask questions. This doesn't limit them to having to be in the same place as you at the same time to be involved in your care. And lastly, we've all gotten the information that the first available appointment for us is in the next 3 months, and there's a big groan or sigh, or is there anything that I can get in sooner? Well, with virtual visits, there is the potential to get seen sooner than an in-person appointment. So I would always encourage you to ask when you're scheduling if your health issue is warranted and a good fit for a video visit or an e-visit, to ask if you can get seen sooner for a scheduled video visit. So all of these benefits have effects and what they can do for you as well, in addition to some of the conveniences that they've created in getting your care. They can reduce the burden and cost of certain travel expenses. How many of you on this call have had to pay for gas to go back and forth to a visit, have to pay for a meal maybe because your visits fall in times where you need to be eating? This can be reduced because you don't have to leave your home and pay for gas, and you can eat food in the comfort of your own home. Additionally, it can reduce the number of unnecessary hospital visits. Even if you can't be seen by your specific provider, getting that care from the comfort of your own home using our video visit on demand option can help alleviate some of those issues that might send you to the ER because you just need to be seen by a doctor. The last thing you want to do is have a long wait time when you don't feel well. It can also reduce the stress put on at-home caregivers who are looking or you rely on to take you to your appointments. It might be easier for them to be more involved in your care because there's some flexibility as well. And then lastly, it's our goal to offer these options to be able to improve your patient satisfaction here at Henry Ford Health. So what are some health concerns suited for a video visit and or an e-visit? This is a pretty robust list that I have here, and I'm going to give everybody a minute or two just to review everything on here. But some of these include arthritis, chronic disease management, cold and flu, diabetes, skin rash, or a sinus infection are all considerations that would be maybe suited for a video visit, whether that's scheduled or an on-demand or an e-visit. I want to note that anything asterisked on this slide also has an e-visit questionnaire. So you can see that there's e-visits for anxiety, for arthritis, for cold and flu. And like I said, I'm going to give you about 30 seconds to a minute to just review everything on this list so you have a good understanding of things that would qualify or be good health concerns to engage in a virtual care visit. All right. So there are some exclusions when it comes to virtual care and video visits. So video visits are not for medical emergencies. If you are having a medical emergency, you should absolutely call 911. If you are driving during a video visit, your doctor will end the visit and immediately for your safety. So you want to ensure that you are never driving during a video visit. Not only is it an unsafe driving practice, but your doctor will end it immediately. And then scheduled video visits are available for patients located in the state of Michigan only at this time. Some providers may have Florida licensure, but if you are in a different state at the time of your visit, you want to ensure that you are reaching out to your clinic before your visit to just see if your provider is licensed in the state that you will be in at the time of your scheduled video visit. All right, so I've got you interested in conducting a virtual care visit of some sorts. I know you're gonna go schedule your first video visit after this presentation. Maybe for your next need, you're gonna try video visit on demand, or you're gonna look into conducting an e-visit. But you wanna know what technology that you might need to ensure that you can participate. So there are two options. The first option is that you need to have an active MyChart Henry Ford account. And you can utilize a mobile device such as your smartphone, Apple or Android, or a tablet. You just need to ensure that you have the following operating systems on your devices and download the MyChart mobile app from the Apple Store or the Google Play Store. Additionally, you'll need to make sure that you have a working camera and a microphone or speakers, as well as access to reliable Wi-Fi or cellular service. The second option is again having an active Henry Ford MyChart account, but this time you're able to use a computer or a laptop. You need to have access to Google Chrome, Microsoft Edge, or Apple Safari browsers, which are your internet browsers. And the link below is the MyChart Henry Ford unique link that you can use to log in. I do want to highlight that Internet Explorer, if that is your default browser on your laptop or computer, you will need to change that because that is not compatible with our video visits. Additionally, your laptop or computer needs to have a working camera and microphone or speakers, as well as access to reliable Wi-Fi or broadband and internet. There's some additional considerations. So you need to make sure that you are signed up for a Henry Ford Health MyChart account, as well as knowing your username and password. I am guilty of this myself. I always forget what my password is because in this day and age, we have so many passwords and usernames for so many different online logins. So it's important that you know what those are. If you don't remember your password or you don't know that you're signed up, you can visit the following website or call the following number to inquire if you have a MyChart account. They can also tell you what your username is, and both logging into the website and/or calling can help you reset your password as well. I mentioned knowing what your operating system is and it being within the necessary operating systems for both Apple and Android. If you don't know how to tell what your operating system is on your device, you can find this in the Settings app on an Apple device under General for iPhones and iPads. And for Android devices and tablets, you can go to the About Phone section and you will find your operating system. Maybe you're unsure if you have a working camera, microphone, speaker, and you want to test to see if you have reliable internet. We've created something called a tech check here at Henry Ford Health, and you can use this link to test all of your devices. That's a smartphone, a tablet, or a laptop or computer. And it will also allow you to preview how you look on camera and adjust as needed. I strongly recommend this because if you've never done a video visit, the last thing that you want to do is have your camera be looking up your nose, at your forehead, or your chin. And I say this lovingly because this has actually happened before. So it's a great opportunity to preview what that's going to look like before you're actually on the visit with the provider. It also gives you an opportunity to test if you are going to be in the location that you'll conduct the visit to make sure that your room is well lit, has good lighting. I would not recommend sitting in front of a window when the sun is shining because that tends to make you a shadow as an individual and make you very dark, making it difficult for the provider to be able to see you. So this is a great option to just get yourself more comfortable and feel confident in the equipment that you're using, that it's going to be working and reliable with the provider at the time of your visit. And then lastly, in alignment with making sure that you're in a well-lit room, also make sure that it is safe, secure, and private. You can conduct this in your own home. If you are going to take this in a working space, I would just make sure that that has a closed door and it's private so you feel comfortable addressing some of the concerns that you'll be explaining to your physician at the time of the appointment, or if it's a video visit on demand, at the time of the video visit on demand. So now I'm going to go over our video visit demo, which is a video. It's about a 2-minute video. I have shared my screen to share my computer audio. So Marie, if you can just let me know if this is good, but I will click to see if this will start working.
If you are connecting to a
Sounds good.
scheduled video visit using a computer with a web camera or laptop, you must access the MyChart website. Once you are logged into MyChart, click on Visits from the menu bar at the top. To initiate a scheduled video visit, select the video visit appointment, click the green e-check-in button, and complete the e-check-in to verify your information such as medications, allergies, pharmacy, and other health information. Once the e-check-in is complete, click the Begin Video Visit button. If this button is grayed out, it is too early to enter the video visit, or your appointment time slot has passed. If this is the first time you have connected, you will be prompted to allow this website to open on this computer. Select Allow. Complete the download of the Video Connect program by selecting Download and then Run. You will be redirected to the Video Connect app. Click Open if prompted, with your name pre-populated. You must agree to the video user terms and conditions and the video privacy policy. Click Join. Follow any prompts to allow access to your microphone, camera, and speakers. If your name is not pre-populated and it prompts you to enter a portal address, close the window, return to your MyChart page, and click the Begin Video Visit button again and follow the previous steps. If you begin the video visit before the provider has joined, you will be placed in a virtual waiting room. To disconnect from the video visit, click Hang Up. If you get disconnected from the video visit, click Rejoin in the Video Connect window to reconnect. For further instructions and troubleshooting tips, see our website at henryford.com/virtual care or call 1-800-HENRY-FORD. As a reminder, MyChart video visits are not to be used for medical emergencies. For a medical emergency, please go to your nearest emergency room or call 911. To ensure the quality, safety, and privacy of your video visit, do not drive while engaging in the video visit, and be sure to select a quiet, private, well-lit location with a strong internet connection. Thank you for using Henry Ford Health System MyChart video visits.
Awesome, wonderful. So final thoughts. I have provided you with a robust amount of information today, and perhaps some of you feel confident in checking out some of our virtual care options, such as our video visit on demand or our scheduled video visits, or maybe an e-visit. But maybe there are others that feel that they would still like some more information or practice in enhancing their digital and telehealth literacy skills. If that's the case, here are some great resources that I would strongly recommend and encourage you to check out and get comfortable with to increase your skills. The first is the Henry Ford Health virtual care page. This has information that goes on further than this presentation about all of our virtual care options. as well as more informational videos and tip sheets, and you can get some of your frequently asked questions answered. The next resource is Telehealth Access for Seniors. This website provides tech guides for seniors or older adults on setting up various devices. This ranges from MyChart to using Wi-Fi to using Zoom, and it's available in different languages. So these have some tip sheets or guides that you can use if you're trying to get more comfortable with one of these applications. The third resource is Cyber Seniors. This provides older adults with tech training using an intergenerational volunteer model. So you would get paired with somebody who is in a younger generation, and that could be somebody who maybe is in the Gen Z generation or a millennial generation, but an individual who has just grown up and very, very comfortable with technology, but it's designed to help enhance your skills with that one-on-one personal experience. And then Tech Boomers, a free educational website that teaches older adults and other inexperienced internet users basic computer skills about websites that can help improve your quality of life. And this ranges from if you're looking to move your banking from in person to online, you can get more comfortable of how you do that. Maybe you've never purchased anything from Amazon and you're looking to see how you can do that or want to get more comfortable. Or you just want to say, hey, I want to increase my internet safety skills and understanding what I need to be aware of, whether that's knowing what spam is, knowing how to protect yourself from your username and passwords, what have you. But again, these resources extend beyond just our virtual care offerings, because when you feel more comfortable conducting technological aspects, you're more likely to engage with our virtual care options and feel confident in utilizing these to get your health care. And that is ultimately our goal. So that concludes my presentation for today. My sincere hope is that you've learned one new piece of information and that you feel empowered to use our virtual care options. I would love nothing more if you are going to sign up for or schedule a video visit, or maybe you'll test the video visit on demand, or maybe you'll consider the next time you have the need an e-visit questionnaire. If you'd like to contact me directly, my email address is on this slide, as well as our virtual care Henry Ford website. And I will turn it back over to Marie to moderate our question and answer. Thank you so much.
Thank you so much for your presentation today. We really appreciate it. We've had a little bit of chat in the chat box, and I'll get to that in just a moment. I just would like to share, I guess, a personal patient story. My aunt is approximately, of course, we don't want to tell ages, but we'll just say she's in her late 70s. She is immunocompromised, lives in an apartment complex, a senior apartment complex. And I was on vacation. I'm not her primary caregiver, but I would be the one who would be assisting her. And I happened to be out of state at the time when she called me and told me she had very severe COVID symptoms and that they had just started. And she was concerned because she wanted to get to her doctor, but of course, she had really bad chills, was not feeling well, and didn't know how she was going to get to the doctor's office. I asked her if she would be interested in doing a video visit on demand, and she didn't actually really understand exactly what that meant. So I explained it to her, let her know that since I'm a proxy on her MyChart account, I was able to put her in line to see the next available primary care doctor on demand. And that primary care doctor was able to see her, talk about her medical history, that she has some high risk factors for becoming very ill with COVID. They were able to get her Paxlovid prescription called into her pharmacy. And I was able to coordinate with someone else to make sure that she got her prescription and she was able to start it that evening. So it was an incredibly quick process. And this was on a Sunday afternoon. Otherwise, she would have waited to call on a Monday morning, her primary care doctor, and then, been at the mercy of having somebody maybe be able to take her to the doctor's office when she wasn't feeling well, and if they could even get her in at a reasonable time. So this was just a quick example of something that was incredibly helpful. She was very thankful for the quick care. So that was a great, I think, example of where that on-demand service really comes in and helps out. And so that kind of goes to the first question that we had gotten in the chat, which was, you know, even an e-visit, could a prescriber or a doctor prescribe Paxlovid if there was a positive at-home COVID test via an e-visit? So I'm gonna just kind of let Allie handle that.
I saw that you responded to that, so
Yeah.
you handled that really wonderful. And that's the other thing I will say is that Marie, I might have Marie tag team some of these questions with me too, because she's a wealth of knowledge from our team. But yeah, I think you're quite accurate there, Marie. Pending your medical history, that the provider might need additional information, but that is it's absolutely possible for that to be a viable solution for the patient in that instance.
Yeah. So again, the e-visits are that asynchronous, so you don't even have to wait and talk to someone. This is a sort of that asynchronous where I can answer some questions about my COVID symptoms and then have that provider respond, or again, ask those additional questions. We had someone share that they've had some really great interactions via video visits in the past, and I'm super thankful to have heard that. And if anybody else has any experience that they'd like to share with us in the chat, please go ahead and do that. There are times though when there's technical issues. Maybe there's an audio issue, and in this case, Chuck shared that there were some audio echo issues. And what's the appropriate troubleshooting steps that you might take? He asked, of course, is it good to disconnect and reconnect? And my answer, of course, is, turning it off, turning it on again. It kind of solves a lot of those technical issues. And so disconnecting, reconnecting is certainly a good way to troubleshoot. Allie, I don't know if you've got anything to add to that.
Yeah, I mean, I also think it's fair to ask some question. It is a collaborative conversation when you are on with a provider, so you can easily ask them to, do you have is there anything that might be connected to your computer, such as a microphone or a headset that might be in the laptop or computer that you're using. Feel free to kind of ask those questions too if you are troubleshooting, especially in real time. I would say that there's no exactly right way to do everything, but Marie hit the nail on the head there. I think disconnecting and reconnecting is always good, and kind of just going through a checklist of some questions. We do have on our frequently asked questions, there's some troubleshooting suggestions. So I'd also point you there to be able to look those over, and those might also prompt some commentary if you find that your provider and you are having some technology issues on your video visit.
I'd say there's also an opportunity if you're having persistent issues, maybe with a provider, and you're wondering if it might be your connection or maybe the provider's connection. You could also contact our technical support help. And I think we have those resources available as well, and they can conduct a test visit with you. So there are different options in addition to the troubleshooting options that you have at your disposal as well. We had a great comment from Anne, and I'm so glad. Thank you for asking this question. If you have a scheduled in-person visit and you know that there is inclement weather coming, and so hopefully on April 28th, I hope that maybe, snow is not going to be in our immediate future, but of course we do live in Michigan, and certainly we have some pretty bad winter weather, and then we've had some interesting stormy weather as well. Is there an opportunity to turn that in-person visit into a video visit?
Absolutely. I think my hope would be that somebody's proactively reaching out to you to make that a reality for you already, so you don't even have to reactively ask. But it absolutely is a feasible solution. It's something that we actually strongly encourage, and a lot of our clinics do end up doing that. And it's one of the beauties of our virtual care offerings is that just because there's inclement weather or it's treacherous outside doesn't mean that you have to compromise on still getting your care, because the last thing that we all want to have to do is reschedule an appointment and wait even longer to get our needs taken care of.
Absolutely. Chuck, I see that you have a question. Can we get the number for the My Care advice line? If somebody else, I think I've got some team members that we know are on. If one of my team members that are on in the virtual care, if you guys could take a look and possibly pop that My Care advice line into the chat, that would be really, really helpful. Circling back to the previous question, though, thinking about inclement weather, there may be an opportunity as well. If maybe for some reason you don't have transportation or you're not feeling well and it would be difficult for you to get out of the house and you do have that in-person visit, it may also be feasible for you, instead of canceling your appointment, contacting that office to determine if there is an opportunity to do the visit virtually instead of in person. I think a lot of times people think, oh, I just have to cancel this visit. I'm not feeling well, or I don't have transportation, or my caregiver's unavailable. Really think about the opportunity in that case as well. It doesn't have to be inclement weather. It could be just some sort of transportation issue. Think about the possibility of turning that visit virtual as well. Obviously, not every health condition is appropriate for video, and your provider may actually need to see you in person to have some sort of physical interaction, depending on what that condition is. But just keep in mind that virtual could be an option even for some of those as well.
Yeah, the other thing I would add there too, Marie, and I didn't say this, and I meant to say this during the presentation, is when you are looking for that next appointment or trying to schedule, if you're not offered, if you're only offered in person, make sure that you are, if your concern, like Marie noted, is suitable for a video visit, make sure that you do ask to say if there's any video visits that would allow you to be seen sooner, because that sometimes is the case. I know for me personally, I had that instance where I wasn't able to be seen until June for an in-person, but for a virtual visit, I was able to be seen in April. And so that makes a big difference based on the health issue that I was looking to be seen for.
Absolutely. Just waiting to see if we have any additional questions or anybody would like to share. And thanks for popping that in, Courtney. The My Care advice line or the nurse advice line is 844-262-1949. And please note that that line is available 24/7 by 365 days a year as well. And often they will walk through a triage process. And if they think it's appropriate, they may also refer you to the on-demand service if they think that your concern should be seen by a provider. So again, those primary care providers are available 24 hours a day. And what's nice about those primary care providers is that they do have access to your medical record number or your medical information, so they can get a little bit of information about your background. It's not just like you're going to a blind provider who doesn't have any information. So as you've got information available in the medical record, they're able to see that, and then they can also send along the information that you were seen to your primary care doctor if there's some follow-up that needs to be conducted with your actual primary care doctor. All right. Thank you for adding in the the MyChart advocate line as well. So I talked earlier, if you need some additional technical support directly from our MyCare or our MyChart advocates, sorry, I'm getting MyCare and MyChart mixed. Our MyChart advocates, there is some support folks in our contact center who are able to do some in-depth technology troubleshooting with you, as well as potentially conduct a sample video visit with you if you'd like to do that. So again, that's an opportunity possibly to see if your technology is up to date and also if you are comfortable connecting via video. So thanks to my team for throwing that information in the chat for everyone as well. Last call, any questions or any additional questions or comments from our group? And Allie, any other things that you'd like to share from our experience or maybe some of our patient stories that we've had in the past?
Oh gosh. Well, I mean, I think my biggest hope is that you walk away from this presentation encouraged to try our virtual care options. to know that we very much so care about this demographic of our patients and making sure that these are easy to use and accessible, and that there's a lot of options out there to increase your skills. I read and my colleague read our patient comments from our Press Ganey patient satisfaction surveys monthly, and there's just a resounding number of comments of patients who say, I didn't have to drive 2 hours back and forth, or I felt so crummy and I was able to hop on a video visit on demand, get my prescription, and without having to leave my house, and I started to feel better within a matter of hours. And so there's just a lot of benefits if your health concern warrants a virtual care visit. And I would just strongly encourage you to not be afraid to try them and see the benefits that it can have to your healthcare experience.
Agreed. This conversation's a little bit different than if we had had this conversation maybe early in 2020. Obviously, the pandemic opened up a lot of people to being at least the thought of trying a virtual visit, because it was at the time, maybe in some of those months of 2020 and 2021, maybe the best or the safest option for patients to get connected with their providers. I know certainly that a lot of people had also expressed that they do actually like to, see that provider face to face and in person. But again, I think now that we are several years into what was a much longer pandemic, I think, than anyone thought was going to be at the time. We're getting back to that time where we see that there's definite advantages, definite benefits that Allie covered today, so that it's really there to be a care option, not something new and exciting, but really part of the whole care journey. So we really appreciate the presentation today and getting a little bit more information and detail. And thanks for the applause. I see some applause in our participation here. So this really brings us to the end of our event today. As a reminder, this lecture has been recorded and will be available to watch again or share with family and friends. In the next couple of weeks, please visit henryford.com/healthy living, and you'll see where that lecture series is, and you'll be able to access those prior lectures. Before we conclude today, I'm excited to announce the next Healthy Living lecture event on stroke awareness. That registration is actually open today. So please mark your calendar and save the date for stroke, recognize the signs, and reduce your risk. This will be presented on Wednesday, May 24th from 3 p.m. to 4 p.m. This virtual lecture will be presented by Dr. Ahmad Ramadan, who is a vascular and critical care neurologist with Henry Ford Health. In this class, you will learn how to spot a stroke and why time is so crucial to getting medical treatment for the suspected stroke. You'll also learn how to reduce risk factors that can increase your chances of having a stroke. You can go and register for this event by visiting henryford.com/healthy living. On behalf of Allie Hunter and the Senior Healthy Living Program, thank you for joining us today to learn more about virtual care, and I wish you a great weekend. Thank you.
Thank you, everyone.